Hi everybody, it's Missy. This is going to be a vlog. Today's July 20th, it's Friday, and it's not a good day. As I mentioned in my last vlog, my doctor changed me to a medicine called Cymbalta, and it's actually been helping quite a bit with my pain. I think I was mentioning on the 18th that we had had 3 days of on and off thunderstorms all day, all night, and normally that's enough to put me in bed, and with 3 days in a row it's enough to put me in a pain crisis where I'm crying and have no control over my pain, and that did not happen. As a result, with the way Cymbalta is affecting me, I'm having to learn my limits. I'm having to learn basically my pain all over again because it's changed. Yesterday was a rough one. My entire pelvis was hurting, and it was a sharp pain. Again, though, it's not as sharp as it would have been 3 or 4 months ago, or even 7 weeks ago. But I knew that if it continued to rain, that was going to be it. And I was going to have trouble sitting up because that puts pressure on the left side, which is broken and hurts a lot. And sure enough, it kept raining, and well, now I'm in bed, not because this is where it's more comfortable for me to sit, but because I can't sit upright. My left hip is just screaming. I've got to feel like, somebody's stabbing where the scars are on my SI joints, stabbing it with knives, and I've got sciatica going down the left leg, and it's yet another day, as you can see in the window over here. It's all cloudy and overcast. It's raining off and on, some thunder, some lightning. I don't know how long this is going to last, but apparently with the addition of Cymbalta, 4 days of rain every day, especially thunderstorms, starts to overwhelm the assistance Cymbalta is giving me. And on day 5, I'm beginning to feel like I normally do, or I used to, on the first day of rain. My pain's gone up. I'm sitting between an 8 and a 9. Every time I get up and walk, it shoots to a 9 immediately. I can't stand up for more than about 2 minutes before my legs give out. It's just really aggravated. Hold on a second. Spasms. The only reason I'm taping this is taping my bad day. Is because people ask, what's it like to live with chronic pain every day? It can't be, or they say it can't be that bad. Oh, come on, butt, stop twitching. You too, thigh, please. I'm using the webcam attached to my laptop, or I would turn it so you could see what my butt and my leg are doing. Basically, they're twitching and jerking, and it's muscle spasms, and it's because something's irritating the sciatic nerve, probably the weather in combination with the scar tissue, and this is what I end up with. I did take my meds, and I have to wait at least 3 more hours before I can take another breakthrough pill. So it's going to be a rough day. You know, people say things like, you look good, so how can you be in pain? Well, the truth is, the pain shows if you care to look to see the signs. For example, these lines have shown up on my face and are now permanent. They showed up somewhere between the ages of 24 and 27. And the longer the pain has gone on, the deeper those lines have become. Now, even when I forcibly smooth my forehead, you still got it. A pain patient's body has and gives signals to how much they hurt. If you look for those signals, you can see them. It's the people who don't look. And in my experience, that has been the people that don't care, who just kind of look at you quickly, decide, oh, you look okay, therefore you must be fine, and then open their stupid mouths. Another reason I wanted to go ahead and tape today, to show that I do have a legitimate purpose and need for my medications. My guess is going to be by about 4 o'clock I'll be having to use the walker because my left leg is doing the numbness and tingling, and it feels like somebody's playing tug of war with all the muscles down the back of my leg. That's going all the way to the ankle. It's not a very pretty sight. It's not exciting or comfortable or anything. Not for reading, certainly not for stitching. I haven't figured out a way to hold the hoop while I'm laying on my side. And with the right side having gotten worse, I can only lay on my right side for so long before I have to roll over. Now, this wouldn't be a problem except the left side is broken. So if I roll over on that side, I can't even lay on it for 5 minutes. I can't lay on my stomach because it hurts my lower back if I do. So all I can do is rotate between position and position and position, which of course means no sleep. And I did not sleep last night. I was hurting far too much. I did doze off sitting up at one point, but it only lasted like 5 or 6 minutes. But yeah, this is what it looks like on a bad day. And I'm a little concerned that if the rain continues, it will be a pain crisis, whether I want it to be or not. Okay, enough moaning and whining and complaining. I did do something good though. Dyed my hair yesterday, so a lot of the grays are now covered, and the ones that aren't, I gotta get used to this being backwards. The ones that aren't kind of went blonde. It almost looks exactly like it did before I had my first child. But I like it, and normally my hair is up when I tape. This is what's left of my hair. I've been having thyroid issues and it's falling out a little bit. I had a bunch of topics that I wanted to talk about, and I can't remember them. people with fibromyalgia and dysautonomia, POTS, and other conditions like fibro and myalgic encephalomyelitis, also known as chronic fatigue syndrome. They all talk about brain fog, where their brain just doesn't work as well. Their memory is not very good, their short-term memory. They can't think straight, they lose their train of thought. They end up saying a lot. I've heard a term a couple of weeks ago called pain brain. And apparently it's a chronic pain patient's version of brain fog. And yeah, we do get it too. When my pain is this bad, thinking just isn't there. All the muscles in my back, all the way up to my shoulders and my neck, tighten up, and just everything hurts. And the more it hurts, the less I can think. Like right now, it kind of feels like I'm digging for the words I want to say, and they're not always there. There's so much that doctors don't know about chronic pain. One of them is just how badly those of us that have to live with it do suffer. They seem to dismiss it as no big deal. And having excuse me, what was I gonna say? Shit. Doctors. Oh, yeah. Having constant, unrelenting pain every day, especially when the pain has managed to surpass the capacity of your pain meds. It's torture. I tell you, it's torture. It's hell. And the doctors don't know this, and even if they did, I don't think they'd care. But this is what I live with. And it's been this bad now for about 16 years. And it's slowly getting worse. I've had 2 major episodes in the last 12 years that added extra fractures and made my pain 10 times worse with each one. And I just wanted to stop. Just for 5 minutes. Hell, I'll even take 2. I haven't had a day without any pain at all in something like 19 or 20 years. I need a break. Okay. Whining isn't gonna help, so I'm gonna stop this. I don't know if I'm gonna post it. I'm a little scared. Very vulnerable right now. Then I'm gonna do some stretching to see if I can't get the sciatic nerve to let go of the muscles in my leg and my left buttock. And then I'm gonna lay down and read, maybe take a nap. I hope everybody's having a good day, or at least the best day possible. Hugs, and talk to you all later. Bye.